Self-harm is when people deliberately hurt themselves as a way of managing distressing thoughts, feelings, or situations. As a parent, you might notice that your child is cutting themselves. That's the most common type of self-harm. But you may also notice that they are biting themselves or pulling their hair, or they might be scratching or burning themselves or picking at their skin. Those are all other ways that young people sometimes harm themselves. It's important for parents to realise that self-harm and wanting to die are not the same thing. There's lots of reasons why young people self-harm. It can be because they want to make the pain that they're feeling on the inside more visible on the outside. There are some red flags that you might notice as a parent that means you should seek more urgent help. These might be if your child is talking more frequently about killing themselves and they've expressed that they've got a plan for how they might do it. If you notice that your child is self-harming, it is important that you seek professional support as quickly as possible. And to do that, you should arrange an emergency appointment with your GP, or you can call 111. And if you're immediately concerned about their safety or the safety of somebody else, you should call 999, or you should go to your nearest emergency department where they will have trained mental health professionals there who can help. Our first tip is to learn about the importance of validation. When we talk about validation, we mean making a real effort to try and connect with the emotional experience that your child might be going through. It's not the same as agreeing with the behaviour that you can see, but it's making a real attempt to understand the feelings underneath. The first step to validation is really actively listening, making eye contact, being really present with your child. You might try and repeat back a couple of the emotions that you pick out for them, just being curious and say, I wonder if you're feeling really stressed at the moment, or I wonder if that's making you really anxious. What we know is that when a child feels heard and they've had their emotional experience validated, it actually brings down their stress levels and allows them to engage in more rational thinking rather than emotional thinking. Our second tip is to help your child identify their thinking and feelings around self-harm. For your child, their self-harming might feel out of control, it might feel random, and it might feel like it's not their choice. But actually we know that it might happen at certain times and be triggered by certain events. And helping your child to track this helps them to gain some control over their self-harm. As a parent, you can help your child track their self-harm by getting them to keep a diary. They could write down the situations when they're feeling more likely like they need to self-harm, or when they have self-harmed, what was going through their mind, what was going on before. It also helps them build their dialogue with you so that you can work through it together. Our third tip is things that you and your child can do to help them manage their urge to self-harm. One thing your child might be able to do to manage their urge to self-harm is to get involved in a really absorbing or distracting activity. For example, if they like computer games or drawing or exercise, anything that takes their mind off their current urge to self-harm. There are a number of things that you and your child can explore that have been proven to help manage the feelings that get associated with the urge of needing to self-harm. One of those things is changing your child's temperature. For example, splashing cold water on their face or encouraging them to submerge their face in cold water, or getting an ice block and rubbing it on their cheeks. That's been shown to work. Another one is engaging in intense exercise where your child's heart beats really hard or they start to really sweat. That has also been shown to help manage the feelings that are associated with self-harm. Our fourth tip is to develop a safety plan with your child. Alongside your therapist, you'll develop a safety plan with your child, which will include things like the warning signs that they're going to self-harm, the situations where they're more likely to experience it and what might have happened in their context that makes it more likely, who they might tell and how they might do it, ways that they can try and keep themselves safe and what helps, as well as some other things like what they've got to look forward to in the future and maybe some reasons for not self-harming. A safety support plan is particularly important because when your child is stressed and has the urge to self-harm, they may not be thinking completely clearly. So it's a written and agreed document that they can come back to, which might remind them of some of their strategies that they've got for keeping themselves safe. And a safety plan is also a good resource for parents to help you keep your child safe when you're feeling particularly stressed as well. As a parent, when your child is self-harming, we know it can bring up a lot of difficult feelings, as well as the fear and the worry. There may also be the shame and the stigma around it. So it's really important that you try and tap into as many additional resources as you can, whether it's support groups or help for yourself, or whether it's books to understand self-harm, books that your child can read, or books that you can read with your child. There's lots of apps, websites and support groups out there that we really hope you'll be able to access. Remember, it's just as important to look after your own health and well-being as it is to look after your child. So do seek extra support if you need it.